Stop ignoring this. If you are over 55 and your ankles are swelling by the end of the day, your body may be giving you a warning long before something more serious appears. And the mistake most people make is either pretending it is normal aging or immediately assuming their heart is failing. The truth is more important than both of those reactions. Swollen ankles after 55 do not always mean your heart is in danger, but they can involve your heart in a way most people never understand. And if you keep ignoring the pattern, you may miss the early signs that your fluid system, your circulation, your kidneys, your sleep, and your heart are all being forced to work harder than they should. So right now, I want you to do something simple. Take off one sock, just one. Look at the skin where the elastic has been pressing against your ankle or your lower calf. If you see a clear mark, a groove, or a ring that stays there for more than a few seconds, pay attention. If that mark remains for 30 seconds, 1 minute, or even longer before your skin smooths out again, that is not just a sock mark. It is a sign that fluid is sitting in the tissues of your lower leg. Now press your thumb gently but firmly into the skin above your ankle bone. Hold it there for about 10 seconds, then release. If the skin bounces back right away, that tells you one thing. But if it leaves a small dent, a little crater that slowly fills back in, your body is holding fluid. Doctors call this pitting edema, but you do not need the medical term to understand the message. Your body is not clearing fluid as efficiently as it should. And that is where the heart question begins. Many people over 55 notice this exact pattern. In the morning, their ankles look normal. They get out of bed, put on their socks, start the day, and everything seems fine. But as the hours pass, something changes. The shoes feel tighter. The calves feel heavier. The ankles begin to look thicker. By evening, the legs feel tired, puffy, and uncomfortable. Then, after a night of sleep, the swelling improves again, almost as if the problem disappeared. But it did not disappear. It shifted. That is the part almost nobody explains. When swelling builds up during the day and improves overnight, it often means fluid is moving according to gravity. While you are upright, fluid collects in the lowest parts of the body, especially the ankles and feet. When you lie down, gravity changes, and some of that fluid starts moving back toward the bloodstream. That may sound harmless, but your heart and kidneys still have to process that returning fluid. This is why some people with swollen ankles also wake up during the night to urinate. They think their bladder is the problem. They think it is just age. But sometimes what is really happening is that fluid collected in the legs during the day is returning to circulation at night. The kidneys detect that extra fluid and begin producing more urine. So you wake up once, then twice, then 3 times. Your sleep is interrupted. You wake up tired. And the next day, the same cycle starts again. That is why swollen ankles should never be dismissed as meaningless. Again, this does not mean every swollen ankle is a heart emergency. It does not mean you should panic. But it does mean you should understand the difference between swelling that is mostly related to drainage and swelling that may point to a heart, kidney, or circulation problem. Because after 55, the body becomes less forgiving. The systems that used to compensate quietly in the background start losing efficiency. Your blood vessels are not as elastic as they once were. The tiny valves that help move fluid upward may not work as strongly. Your calf muscles may not activate enough during the day, especially if you sit for long periods. Your tissues may hold on to fluid more easily. And if your heart already has any weakness, even a mild one, this extra fluid burden can make symptoms more noticeable. This is why the title of this video matters. Swollen ankles after 55 may involve your heart, but not always in the way you think. Sometimes the heart is the primary problem. Sometimes the heart is simply being forced to handle the consequences of poor fluid drainage. And sometimes the swelling is mostly coming from the veins, the lymphatic system, medication side effects, kidney changes, low protein intake, too much sodium, or hours of sitting without enough movement. The danger is not just the swelling itself. The danger is assuming all swelling has the same cause. Let me give you a simple example. Imagine two people with the same swollen ankles. One person has swelling because they sat most of the day, moved very little, ate a high-sodium dinner, and their lymphatic drainage slowed down. The other person has swelling because their heart is struggling to pump efficiently, and fluid is backing up into the legs. From the outside, both ankles may look similar. But inside the body, those are two very different stories. One may improve with movement, elevation, hydration, better food choices, and a simple nightly routine. The other needs medical evaluation, testing, and treatment. This is why you cannot just guess. You need to know the signs. So before we continue, listen carefully. If your swollen ankles come with shortness of breath, chest pressure, sudden weight gain, difficulty lying flat, waking up gasping for air, severe fatigue, or swelling that appears very suddenly, especially if one leg is much more swollen than the other, that is not something to manage at home. That is a reason to contact a doctor urgently. If one leg is painful, warm, red, and swollen, especially if it happened quickly, that can be a sign of a blood clot. Do not wait on that. But if your swelling is gradual, if it affects both ankles, if it becomes worse by evening, if it improves after you sleep, and if you do not have severe breathing symptoms, then what you are seeing may be part of a drainage and circulation pattern that can often be improved when you understand how it works, and that is what most people were never taught. Your body has more than one way to move fluid. Everyone knows about blood circulation because everyone knows the heart pumps blood. But there is another system working quietly in the background, the lymphatic system. This system collects excess fluid, proteins, waste, and inflammatory material from the tissues and helps return them to circulation. But unlike your blood circulation, the lymphatic system does not have a powerful central pump. It depends heavily on movement. Your calf muscles, your ankle motion, your walking, your breathing, and even gentle pressure changes in the body help move lymph fluid along. When you move less, the drainage slows. When drainage slows, fluid sits longer in the tissues. And when fluid sits in the tissues long enough, your ankles begin to swell. This is why sitting for hours can make swelling worse. It is not only because your legs are down, it is because the calf muscles are not doing their job as a second pump. Every time you walk, rise onto your toes, flex your ankles, or contract your calves, you help push fluid upward. But when you sit still, especially after 55, the system becomes sluggish. And this matters for your heart, because the fluid does not vanish. What does not drain efficiently during the day often returns later, especially when you lie down. Then your heart and kidneys have to deal with it at night, when your body should be recovering. So if you have been looking at swollen ankles and telling yourself, it is nothing, I want you to think differently from today forward. Do not panic. Do not self-diagnose. But do not ignore it either. Your ankles may be showing you that your body is struggling to manage fluid properly. And when fluid management becomes inefficient, the heart can become involved, either as part of the cause or as part of the burden. Now that you understand why swollen ankles after 55 should not be ignored, the next step is learning how to separate one type of swelling from another, because this is where most people make the biggest mistake. They look at swollen ankles as if swelling is one single problem, but it is not. Two people can have ankles that look almost identical in the mirror, yet the cause inside the body may be completely different. One person may have a vein problem, another may have a lymphatic drainage problem, another may be showing early signs that the heart or kidneys are struggling with fluid balance. And if you treat all three the same way, you can waste months doing the wrong thing. This is why some people are told to cut salt, but the swelling barely changes. Some are given water pills, but their ankles still look puffy every evening. Some buy compression socks, but never understand why one day they help, and another day they do not. The problem is not always that the advice is wrong. The problem is that the cause was never clearly identified. So let's make this simple. There are three common patterns of lower leg swelling after 55. The first pattern is venous swelling. This means the veins in your legs are struggling to bring blood back up toward the heart. Your arteries send blood downward into your legs, but the veins have to push it back upward against gravity. To do that, your veins rely on small one-way valves that keep blood from falling backward. When those valves weaken with age, blood begins to pool in the lower legs. Pressure rises inside the veins, and that pressure pushes fluid out into the surrounding tissues. The result is swelling around the ankles and lower legs. Venous swelling often gets worse after standing for long periods. If you spend the day on your feet, your ankles may look much worse by evening. You may also notice visible varicose veins, aching, heaviness, or a brownish discoloration around the lower shin or ankle area. Some people describe the legs as feeling tight, tired, or full, especially after a long day. This type of swelling can still involve the heart indirectly, because the veins are part of the system that returns blood to the heart. But the main problem begins in the legs, with pressure, gravity, and weakened valves. The second pattern is lymphatic swelling. This is the one many people have but rarely hear about. With lymphatic swelling, the issue is not primarily the blood inside the veins. The issue is the fluid sitting in the tissues. Your lymphatic system is supposed to collect excess fluid and return it to circulation. But after 55, this system may slow down, especially if you sit for long periods, move less than before, have inflammation, carry extra weight, or have had surgeries, injuries, infections, or radiation in the past. Lymphatic swelling often feels more puffy than tight. It may leave a dent when you press the skin. It may involve the top of the foot, not just the ankle. You may notice that your shoes leave marks, your socks leave deep lines, or the swelling improves somewhat after lying down overnight. In early stages, this swelling can come and go. In the morning, the ankle may look almost normal. By evening, it returns. That daily pattern is a clue. But over time, if lymphatic congestion continues, the tissues can begin to change. The skin may become thicker. The top of the foot may become harder to pinch. The swelling may stop disappearing completely overnight. This is why early attention matters. The third pattern is cardiac or kidney-related swelling. This is the one people fear most, and it is the one that must never be ignored when it comes with other symptoms. When the heart is not pumping effectively, fluid can back up into the legs. When the kidneys are not filtering properly, the body can hold on to extra fluid and sodium. In both situations, swelling may appear in both ankles or legs, but the key difference is that the swelling usually comes with other warning signs. You may feel short of breath. You may feel more tired than usual. You may gain several pounds in a short period of time without changing your diet. You may wake up at night gasping or feel uncomfortable lying flat. You may notice your belly swelling along with your legs. You may urinate more at night. You may feel weaker walking short distances than you did before. That combination matters. Swollen ankles alone do not automatically mean heart failure. But swollen ankles plus breathing trouble, sudden weight gain, chest discomfort, or severe fatigue is a different story. That is when the swelling becomes part of a larger warning pattern. And this is why the title says swollen ankles after 55 may involve your heart. Not because every case is a heart problem, but because the heart sits at the center of the body's fluid management. Even when the swelling starts in the lymphatic system or the veins, your heart still has to handle the fluid that eventually returns to circulation. Now let me tell you about a woman I will call Margaret. Margaret was 67 years old. She had spent most of her adult life working as a school secretary, sitting for long hours, standing only when necessary, and taking care of everyone else before taking care of herself. She was not severely overweight. She did not smoke. She had no major heart diagnosis. But for nearly 2 years, her ankles had been swelling by evening. At first, she ignored it. She bought looser socks. Then she bought wider shoes. Then she stopped wearing the shoes she used to love because they felt too tight after lunch. Every morning she told herself it was better. Every evening it came back. Eventually, she became afraid. She thought, maybe this is my heart. So she went to her doctor. Her heart was checked. Her basic tests looked acceptable. She was told to watch her salt and was given a mild water pill. For a while, she thought that would solve it. But it did not. The pill made her urinate more during the day. She felt thirsty. Sometimes she felt lightheaded. But by evening, her ankles were still swollen. Not always as much, but enough to bother her, enough to make her worry, enough to make her feel older than she was. Then one small detail changed the whole picture. She noticed that on days when she walked more, her ankles were actually better. Not worse, better. When she went to the grocery store, walked through the aisles, carried light bags, and moved around the house afterward, the swelling was less noticeable. But on days when she sat for hours watching television, paying bills, or riding in the car, the swelling was much worse. That clue mattered, because swelling that improves with gentle movement often points toward a drainage problem. The movement activates the calf muscles. The calf muscles help push fluid upward. The lymphatic system starts moving. The veins get support. Fluid that was sitting in the lower legs begins to clear. Margaret's heart was still important, but it was not necessarily the starting point of the problem. Her body was not failing all at once. Her drainage system had simply become sluggish, and the fluid was being allowed to accumulate day after day. Now compare that with someone else. Imagine a man, 72 years old, who notices both ankles swelling, but also starts waking up at night short of breath. He used to sleep flat, but now he needs 2 pillows. Walking from the bedroom to the kitchen leaves him more breathless than before. His weight goes up by 5 pounds in 1 week. His swelling is not just a cosmetic issue. It is part of a bigger pattern. That is not the same situation as Margaret. That person needs medical evaluation quickly because the swelling may reflect the heart or kidneys struggling with fluid overload. This is why you must pay attention to the full picture, not just the ankles. Ask yourself, did the swelling come gradually or suddenly? Is it in both legs or mostly one? Is it better in the morning and worse at night? Does it improve when you walk? Does it come with shortness of breath? Are you gaining weight quickly? Do you feel chest pressure? Are you waking up gasping for air? Is one leg red, warm, and painful? These questions matter because they separate ordinary fluid congestion from something potentially urgent. There is one more thing people often overlook: medications. Some blood pressure medications, especially certain calcium channel blockers, can cause ankle swelling. Anti-inflammatory pain medicines, steroids, hormone treatments, and some diabetes medications may also contribute to fluid retention in certain people. This does not mean you should stop any medication on your own. Never do that without speaking to your doctor. But it does mean that if your ankles started swelling after a medication change, that detail is important. Bring it up, write it down. Do not assume it is unrelated. Now let's return to the pattern most people over 55 recognize. Gradual swelling, both ankles, worse by evening, better after sleep, and no severe breathing symptoms. In many cases, this pattern is strongly connected to movement, drainage, sodium, hydration, protein intake, and how much time your legs spend below the level of your heart. That means there is something you can begin observing immediately. Tonight, look at your ankles before bed. Press your thumb above the ankle for 10 seconds and notice whether it leaves a dent. Then, tomorrow morning, before you get out of bed, look again. If the swelling is much better in the morning, that tells you gravity and drainage are playing a major role. Then pay attention to what happens during the day. If sitting makes it worse and walking makes it better, that is another clue. If standing still makes it worse but moving helps, that is also meaningful. If nothing helps, if swelling is getting progressively worse, or if new symptoms appear, that is when you need medical evaluation. The goal here is not to scare you. The goal is to stop you from ignoring a signal your body is repeating every day. Because swollen ankles after 55 are not just about how your legs look. They are about how fluid is moving through your body. They are about how hard your veins, lymphatic system, kidneys, and heart are working together. And when one part of that system slows down, the others have to compensate. Now that you understand the main types of swelling after 55, let's bring this back to your daily life. Because for many people, swollen ankles are not caused by one dramatic event. They are caused by small habits repeated every day. You wake up and your ankles look better, so you assume everything is fine. Then you sit for breakfast, sit in the car, sit at work or at home, stand for a while, then sit again. Hours pass with your legs down and your calf muscles barely working. By evening, the ankles swell again. Then you lie down, some of that fluid moves back into circulation, Your kidneys respond, and you may wake up at night to urinate. The next morning, the swelling looks better, and the cycle starts again. One of the biggest causes is sitting still for too long. Your calf muscles act almost like a second pump. Every time you walk, flex your ankles, or rise onto your toes, those muscles help push fluid upward. But when you sit for hours, that pump becomes quiet, and fluid begins to collect in the lower legs. Standing still for too long can also make swelling worse. Walking is different because it activates the muscles. But standing in one place allows gravity to keep pulling fluid downward without much help from the calf pump. Another major factor is hidden sodium. Many people think they do not eat much salt because they do not use the salt shaker. But sodium is often hidden in bread, cheese, deli meats, canned soups, sauces, frozen meals, restaurant food, crackers, and condiments. For someone whose drainage and circulation are already slower, that extra sodium can quickly show up as swelling around the ankles. Drinking too little water can also backfire. Many people with swelling drink less because they think water causes fluid retention. But dehydration can make lymph fluid thicker and slower. The better approach is to drink steadily earlier in the day and avoid large amounts of fluid close to bedtime, especially if you already wake up often during the night. The evening routine is especially important. For many people, the worst swelling happens after dinner. They eat their largest meal, often with more sodium than they realize, then sit in a chair or recliner for 2 or 3 hours. The legs stay down, the calf muscles stay inactive, and fluid continues to collect. Then they go to bed, and the body spends the night trying to move that fluid back into circulation. So tonight, try something simple. After dinner, walk gently for 5 minutes. Not as exercise, not to get tired, just to activate your legs. Then, while seated, do 20 to 30 slow ankle pumps. Lift your toes up and down with your heels on the floor, then point and flex your feet. Later, before bed, elevate your legs if it feels comfortable. The goal is to get your ankles higher than your hips, or ideally above the level of your heart. You can lie on the bed and place your legs on pillows. Some people place their legs against the wall for a few minutes. Do not force anything, and stop if you feel pain, numbness, or discomfort. You can also add slow breathing. Breathe through your nose, let your belly rise gently, then exhale slowly. This helps relax the body and supports the natural pressure changes that help fluid move. If your legs are not painful, red, hot, or swollen only on one side, you can gently stroke the skin upward from the ankle toward the knee using light pressure. Always upward, never downward, and never aggressively. But remember this clearly. If your swelling is sudden, severe, painful, red, warm, or mostly on one side, do not treat it as simple fluid retention. If it comes with shortness of breath, chest pressure, difficulty lying flat, sudden weight gain, fainting, or waking up gasping for air, seek medical help urgently. Those signs may involve the heart, lungs, kidneys, or a clot, and they should not be managed at home. But if your swelling is gradual, affects both ankles, gets worse by evening, improves by morning, and does not come with severe symptoms, then your body may simply need help moving fluid more efficiently. So here's what I want you to remember. Swollen ankles after 55 are not always a heart emergency, but they are never something to ignore. They may be a sign that your circulation, lymphatic drainage, kidneys, and heart are all working harder than they should. Starting tonight, pay attention. Look at your ankles before bed. Notice whether your socks leave deep marks. Press gently above the ankle and see whether the skin leaves a dent. Then add 5 minutes of gentle movement. Reduce one source of hidden sodium tomorrow. Drink water earlier in the day, and elevate your legs before sleep if it feels right for your body. Do this for 2 weeks and observe what changes. Notice your ankles, your shoes, your sleep, your nighttime bathroom trips, and the heaviness in your legs. Your body usually speaks softly before it speaks loudly. Swollen ankles may be one of those quiet warnings. Do not panic, do not guess, but please, do not ignore it. If this video helped you understand what may be happening in your body, subscribe to the channel, leave a like, and share it with a friend or family member who may also be ignoring swollen ankles after 55. Sometimes one shared video can help someone notice an important warning sign before it becomes a bigger problem.